Hi everyone. For those of you who don't know me or are less familiar with me than the other three, I'm Cian. And along with Chris, I'll be going through some of the programming stuff, but my main gig is this: injuries and pain as a non-clinician. This is about as complex and risky an area you can get into as a coach, but it's one you can't ignore anymore. A bit of background on how I reluctantly, or probably more accurately, unintentionally have become the injury guy, if you will. The more you do something, the better you get at it, and I'm still undefeated in the game that is dodge scalpel. Poor training from coaches and as I was educated left me unprepared for the demands that were placed on my body, and this resulted in a whole slew of injuries. When I started coaching with Angus, I remember laughing and joking that I couldn't give him my injury history. From acute, chronic to recurring, this kind of put me in a box where I was told I can't and could never do certain things. I also thought I was broken, but over the last couple of years, I've navigated an ACL tear and a labral tear in my hip, or possibly a psoas rupture. Still don't know, but that's what we're going to talk about today, what I've learned from these and how this can help you. Contrary to first impressions, my goal here isn't to get clinicians to kill me. It's not even really to impact you. That'll happen as a byproduct. It's really your athletes and the people that you deal with that is the end goal here. I think there's three things in particular that the athletes need. First, it's recognizing the resilience of the human body. So they're not afraid of normal human movements or things that they have to do in their sports regardless. Second, it's about realizing that they have all the tools they need to heal, that the body is what heals itself, that it's regression to the mean or natural history and what they do that is going to determine their outcomes. It's not a therapist's thumbs or needles or passive bullshit treatments. And finally, it's to educate them so that they're informed athletes, if you will, so that they can spot some of these bullshit messages. First, an important disclaimer: talking and dealing with injuries as a coach is like looking over a fucking cliff. Scope of practice is black and white. A message you're going to be tired of me saying, if you're not already tired of me saying it, is don't be complaining of winning stupid prizes when you play stupid games. In this instance, that's knowing where the edge of your scope of practice is, but also your competency. So developing self-awareness to knowing when you don't know what you don't know. Unfortunately, in the real world, it's not as black and white as I just made it seem. It's a little bit more grey. Many people can't tell the difference between a coach and a clinician with certain things, or rehab and training. Or maybe they just don't care. I mean, if a physio has cleared an athlete to return, but they're not ready to take part in full practice, is that person still injured? Or do we need to refer to clinicians at every sign of pain or injury? You'd be kind of fucked as a coach there, but also I think that is very harmful for the person who's experiencing the pain or injury, as it sends an implicit message that they need to go talk to a professional every time they feel pain. And much of this is down to what I'll call the first elephant in the room, if you will. And that's just shit practitioners in both camps. Poor coaches loading people beyond their capacity end up with clinicians. And then the flip side of this is also true. I end up coaching people who have quote unquote failed physiotherapy or have had the same recurring injury, only to go to the same person to get temporary relief from bullshit passive treatments. It's a feedback loop of sorts. And this really brings us to our first problem, which is you don't know what you don't know until you know. But because you're human, that doesn't stop you from thinking you know what you don't know but think you know. And because of that, you will talk about this to other people and think that you know what you don't know. And I'm worried that this analogy is going to go over your heads, but for the Irish people here, it's not. So back in November, I was in a bar in New York and I saw the American in front of me had ordered a pint of Guinness. I think I made a face and I was saying to my two American friends how you won't catch an Irish person ordering a pint of Guinness outside of Ireland. The American asks a few questions and it turns out he's been drinking Guinness in this pub for years. All his friends have, and he's never had an issue. Don't ask me why, but this monstrosity ended up in front of me, which meant it didn't look like this. Guinness is a 2-pour, so you pour about 75% of the way up, you wait for it to settle and it'll turn black, and then you finish it. The pint I got was a 1-pour, so it was just poured in one go. You can see those bubbles in it, and it felt, the experience was like a fizzy or carbonated drink. It was the worst Guinness experience I've ever had. But back to our friend at the bar, he knew no better, so he had nothing to compare it to. He didn't know what a real or proper Guinness would be like. It also does one of the big jobs that an alcoholic beverage does. It provided alcohol. This is a huge meme in Ireland, with Guinness experts on TikTok and that Instagram account, Shit Pints of London Guinness. It's also massive on Twitter as well. If the injury clinicians don't kill me, maybe the psychologists will. But psychology underpins absolutely everything we do, and it's critical that we have a working knowledge of at least some of it. I know nothing in this domain, relatively speaking anyway, so I defer to people like Hugh here, and it's something we'll go into more detail in the post-seminar content. But for now, all I want to touch upon is a few things. First, your response is going to matter more than what's actually happened. But we can't wait for things to happen, so we make these predictions. And this is essentially placebo or nocebo. It makes sense that negatives are disproportionately more effective on us. But to make predictions about anything, we kind of have to have some beliefs. So beliefs underpin all of this. As we get into injuries and pain, we need to first define what both of them are. So let's look at a couple of examples. You might remember at the start I spoke about a labral tear and a psoas rupture. So you can see here that my right hip is incredibly limited in terms of movement. However, it's been like that for as long as I can remember, and this is not an injury. Aside from these restrictions, there was no other symptoms. So there was no pain. I could do this kind of stuff. So then we've got a question of, is it an injury or is it an adaptation? And if there is an actual restriction there, or if I'm just self-selecting range of motion due to the structural changes at my hips. Yes, there was an injury later on, and it's still unclear what that is or was, but that's besides the point. This, on the other hand, is most certainly an injury, and it was my ACL and LCL tear in September 2020. Funnily enough, this is also the reason that I could do what I did in the previous slide, with this being the catalyst for my ability to finally squat. And then once I exhausted the regular L-sit working on regaining terminal knee extension, I moved on to the straddle L-sit. So I was very shocked that my hip could actually work more like a hip. So for the purposes of this seminar, let's define injury, and acute injury at that, as a sudden onset of symptoms that impair you with an attributable cause. So with the ACL example, it's a hyperextension of the knee and a twisting that resulted in a snap, crackle and pop, or a tears and a couple of fractures. But that's besides the point. We're not really going to touch upon chronic injuries in this part, at least. We just don't have the time. And whatever about chronic injuries, pain is incredibly weird. and we're very limited with what we can cover here. But many people are unaware that you can have pain without an attributable cause or an injury present. And you can also have an injury without subsequent pain. I think explaining pain is more painful than any pain. And you're kind of damned if you do, damned if you don't, because everybody knows what it feels like to be in pain. Until you know that an option is open to you, you can't really take that option. And that's what I think upgrading your knowledge on pain can do. The best thing we have for pain right now is the biopsychosocial model. And pain ultimately is a good thing. It helps to keep us safe. And it's just one way your body is trying to communicate with you. Another way to think about this is it's your body's opinion of what's happening and what's most important right now. And your body's goal is ultimately just to keep you alive so that you can pass on your genetics. Pain is more than one thing. It's a sensation like vision or touch. It's an emotion like anger or sadness. And it's also like a drive state that compels action like hunger. For athletes, the role of pain depends on how these different effects mingle together in their specific situation. Sometimes pain slows them to a halt, other times it drives them to greater heights. I think that's the best quote I've heard so far on pain. But to circle back to our Psychology 101 slide, think about the beliefs that would support how you experience pain. And let's not think about pain, let's think about hunger. Note how your mood changes. Note how, at the end of the day, you know you're going to eat relatively soon. You're going to be okay. It will pass. And then compare this to maybe a child, a baby, where they haven't learned this. It's the worst feeling imaginable. Your experience of hunger will be completely different if you didn't know where your next meal was coming from. It's all those contextual factors around the event that will determine how you respond and how you experience it. And all of this isn't to say that there's always a clear-cut reason as to why you're in pain either. So why do injuries and pain even happen? We don't really know. And I'm going to leave trying to explain why we're in pain here, because that's so much more difficult than injury. We can't reduce either of these down. The best we have is our biopsychosocial model. But saying this, we can say that the body's ability to tolerate load has been surpassed, or load has exceeded capacity. Load exceeding capacity resulting in injury is as helpful as reducing the obesity crisis down to a problem of energy in, energy out. It doesn't really help anybody or move the conversation forward. There are two sides to this equation. So up first you have got, are you prepared for the demands that you're asking of your body? And then the other side is, what are the demands that are being asked of the body? Which one is it? Why is this happening? And what can we do about it? Well, it's both. And something I don't hear anybody really talking about is that the demands of the sport are the demands of the sport. It's not a modifiable risk factor. And the demands that are being placed on athletes are a lot less controllable than we'd maybe like to believe or admit. First, you've got internal versus external load. Just like you can't step in the same stream, exactly the same again, you're kind of a different person every single day. And you will experience the loads a little bit differently depending on all of the other psychosocial factors. And if you're working in S&C, you don't really get to control sport practice, for example, or the scheduling. So you'll have players that are doing too much pretty much all of the time, which brings us to the other side of the equation. Being prepared for the demands, or being as prepared for the demands as you possibly can be. We have two big problems. One is shit training. and 2 is good training that isn't done. So there's nothing wrong with the plan, but the plan isn't really being executed. And we'll be covering more of this in the mentorship. We prepare for the demands by training, and training is different from competition. It's different from testing. It's different from exercising, and it's different from physical activity. It's goal-oriented. It involves the manipulation of variables to do more over time. That's kind of it. And the most useful lens I have for looking at this is through the lens of drugs, medical or recreational. To preserve a modicum of professionalism, I'm going to go the medical route. So you've got a reason to prescribe, and then you've got a specific drug. The effect of this drug will be determined by its dose. You'll have an insufficient dose, you'll have a therapeutic dose, and you'll have a toxic dose. How much you need will be very individual, so you titrate to effect. Don't use a lot when a little will do. A training cycle mirrors a training session, for example, and this is like titrating to effect, where you gradually ramp up the intensity, so you gradually take more of the drug to find what dose is therapeutic for that person. This therapeutic dose, coupled with the half-life, or how long it takes for you to adapt, is going to determine the frequency at which you train. You'll also have contraindications, interaction effects as you stack more exercises and different types of training on top of each other. You'll have side effects and adherence issues. And then you have to consider the course length. So are you taking this forever, or is it just to solve a specific issue? Circling back to Psychology 101, it is your beliefs that will determine your expectations, both in the acute and your long-term recoveries. I think this is the biggest predictor of positive outcomes. Those who recognize that injury is part of the entry fee to life and sport, and maybe not immediately, because it can be like grieving, literal grieving, by the way, but they see it as an added challenge and they can see the positives. Tearing my ACL was one of the best things to have ever happened to me. And I'm so grateful for it. Without it, I wouldn't be here. I wouldn't have met Angus or Chris or Matt. It's all the same. And the injury simply constrained what I could and couldn't do if I was to have a positive outcome. It forced me to do something I wasn't ready to do, which was accept where I was at. I've heard another extremely competent coach talk about how her condition has given her a vested interest in developing and maintaining her ability to move. And how counterintuitively, this will probably mean that she's in a better place 5-10 years down the line than somebody who hasn't got her condition. And this is pretty much a mirror image of my own experience tearing my ACL. I'm conscious that I've leaned far too heavily on personal anecdotes, so here's a case study of somebody else. This comes from Ido Portal's YouTube, and I think it's about a 6-minute long video. It's an excellent watch. But I want you to put yourself in Johnny's shoes here. You've just torn a muscle off the bone, full, complete rupture. What's going through your mind? How are you feeling? What are you going to do next? And yeah, what are some of your beliefs around an injury like that? I'm sorry, what? Obviously, Johnny is very calm, a little bit crazy, but he has got utmost faith in his body and its ability to heal. He understands that injuries are the price of entry, basically, to training hard. And there's a very real cost to doing unreasonable things physically, which means he has got a completely different relationship with pain than, say, somebody who has never trained in their life before, and then they're experiencing DOMS, really bad DOMS for the first time in the world. I'm sure you've all heard someone talk about how sore they are is the worst thing that they've ever experienced. There are a number of things that stick out with this. First are the thousands of arm circles. This is programming 101. If something is as low level as this, you're probably going to need an absolute fuck ton of them to see any real change. Second is any of the hanging variations he's doing. He even does a chin-up. These are very basic exercises for a pre-injury Johnny, but they're not what you would call basic or entry level with catastrophic injuries like this. Even just from a safety point of falling down and having to break your fall. And the final thing is the very simple push-up variation he can't do yet. It's only been 4 days. But pain is so fucking weird. If your body can express it, you might as well express it. Whether it's explicitly stated or not, pain is going to be the guide. And if you are in tune with your body will tell you whether this is a good or a bad idea. You don't doubt your doubt. If you think this is going to hurt, or if you think this is a bad idea, chances are it's probably going to be a bad idea. And if we adhere to the training principles of like titrate to effect, you'll have warmed up to what you've done. So you have got a bank of evidence of what you can do in that moment. Issues arise when you second guess yourself, or when you push too hard, too soon, or too often. It's a rule of twos. And at the end of the day, this too shall pass. So it's very rare that an injury will be that catastrophic that you can't return from it. This is why we're here as humans. This is why we've evolved. We are so fucking resilient. And at the end of the day, this too shall pass. So let's look at a potential framework you can use like this. First things first is, because you know you stay calm and you reassure yourself that next, I'd probably look for an obvious cause. This will probably check your injury box. But if you're anything like me, more often than not, this will be an ego box. So this is simply just a variation I haven't been patient enough with, or I haven't spent long enough building up. I've experienced pain on pullovers intermittently for 15 years. And you can run through a checklist like this. Is there a load that I can use? Is it only happening after a certain amount of reps or a certain amount of sets? If I slow the movement, does this help? Is there a short amount of motion that I can move through pain-free? Or is there a variation I can do? Finally, some of these modifications will miss something. And chances are you can probably figure out a way to hit it another way. With this movement in mind, I just need to do with an easy curl bar